Today, I want to talk to you about advocacy and cups, empty cups, semi full cups, overflowing cups, and everything in between. Because cups are very helpful to me in terms of imagery when I think about what advocacy means in my life, what I think it should mean to everyone who considers himself a healer or a caregiver, as we all should consider ourselves, whether we are in the practice of medicine or at the bedside with our family members and the things that we sometimes forget when we decide to be on an advocacy journey. And I hope that some of these musings are helpful to you as you decide whether to engage in it a little bit more intentionally, or if it's already part of your professional identity, how to deepen that practice. So, if you know me and you've heard me talk before, I always start my talks with definitions to make sure we have a shared language about what it is we're talking about. So, we're going to talk about what advocacy even is. I'm going to try to convince you that we all do it, whether we realize it or not. I'm going to spend a little bit of time talking about why we need to more intentionally engage in it, especially now. And then I'm going to tell you a story I read a long time ago that really helps me remember what I frequently forget in life, but certainly in the practice of advocacy. All right, so basics, definition, advocacy. It's defined as public support for or recommendation of a particular cause or policy. So if you have an opinion in your mind about a course of action or something to do, because that's really all a policy is, and you've decided to make that opinion public in some way, shape, or form, that's it. That's advocacy. And so what you may start to think about is what are the things that I have advocated for? So I'll give you an example, something really basic. I think Starbucks soy latte should cost less than $7. And I think that way because my love for Starbucks soy lattes makes my husband have opinions about how much money we spend on coffee every day, every week, not every day. Um, Not because I have a lot of evidence about the impact of Starbucks on labor or wages or anything like that. Advocacy can and should be evidence-based, and it should come from mouth of experts, but sometimes that expertise is lived, not data. There's a combination in advocacy. So I had this opinion about Starbucks, but as soon as I voiced it to you, I've stood on the stage and advocated for Starbucks lowering their prices, and I stand by that point, but that's not what we're here to talk about today. The point is, hopefully you'll realize, is that as soon as you express an opinion and you've made it public, you've advocated, and we all advocate in some way, shape, or form, probably often, probably without realizing it. And that's okay. There can be so much fear in terms of taking on that identity of being an advocate. Am I doing it right? Am I engaging in this journey? But the truth is we do it. And this is what I'm here to tell you about is that hopefully your response to that isn't to say, maybe I should keep my mouth shut and not say things out loud, and instead have the reaction of, well, how can I make it more intentional then? If I'm always going to be advocating for something, how can we make it more intentional? So, what might advocacy look like? Well, I think it's very easy to recognize when it's opinion editorial in a newspaper or a medical commentary in a journal. We know that that's what advocacy can look like professionally or in lay media. But in this lightning speed transfer of information era that we live in, any variety of forum that is public can and has been used for advocacy, whether that's Twitter, Instagram, TikTok, I missed one, Facebook, personal blogs, websites, anything that's public has and can be used for advocacy. In addition to written communication that may not have as wide of an audience as we think of, but that is still expressing our opinions. So, for instance, an email to a colleague about a clinical practice guideline, an email to a colleague or a group of colleagues about a case in the unit or an issue with a trainee. All of this can be advocacy, whether we realize it or not. It obviously also can look like plain talking, and it's very easy to recognize when someone's in front of an audience or in front of a podium, but it could also be speaking up in a meeting or putting in a Zoom comment in a meeting or speaking up on rounds. And these are all ways that we can advocate and probably do advocate, again, without even realizing it. So hopefully I've convinced you that we're all doing this. So why should we be doing it more intentionally? Well, really, there's so many benefits. And the truth is that this is where I want you to follow me into the land of metaphorical cups. So I see the advocacy that you and I do every day as contributing drops of water or streams of water or rivers of water into cups of different sizes. And the cups can be really small and hyperlocal, or they can be giant and federal sized. But if there is an issue, there is a cup. It may be really bone dry if no one's venturing to talk about an issue, but it's there and it matters whether we want to fill it or not. So those large federal cups, if we need examples of how advocacy has contributed, there's wins that I've been lucky to witness just in the last few years, and I'll list them for you because we all need to have those experiences, those reminders of when advocacy wins happen. So for instance, when pediatricians came together to secure funding for the Children's Health Insurance reauthorization, got 10 more years of funding. That was in 2018. Same year, lots of physicians, lots of healthcare providers, lots of families, including lots of pediatricians, came together to speak out about the family separation policy at the southern border. And on a big scale, it's very hard to identify what the tipping points are for legislation. But what we do know is that legislators did talk about the pressure that they were hearing from many different backyards across the country. But the cups can occur on a local scale. So for instance, in an institution, I've been very privileged to see some NICUs starting to disaggregate their quality improvement outcomes by race, ethnicity, and preferred language because of a local champion who decided this was really important for them to do. And that local champion, being able to make this something that an entire institution, or at least a unit, could start to do, allows people to start to measure disparities that we could all presume were there, but until you measure them, just like we heard of with the data talk, until you measure them, we can't really address them. I've been privileged to see that in my own birthing hospital. It started with a then fellow, Dr. Michelle Marie Peña, who got stolen to Emory, but it was her advocacy and her work to disaggregate outcomes that led to some of our equity-focused quality improvement work. And then the cup can occur on a really individual scale, a patient or a family member. For instance, the story I want to tell you here is one of my colleagues who learned about a family's concern about the mold in their apartment in West Philadelphia, and they became like a dog with a bone about this issue, signing it out every night, signing it out to the social worker, sending repeated emails every time we would switch blocks and have service block attending switches. She would talk about it, and eventually that led them to be connected to the legal services that they needed in order to be able to address mold remediation with their landlord. And that may seem like a small win when we think about CHIP reauthorization for 10 years in the country. But that baby who was able to wean off oxygen before discharge, who we had poured thousands of hours and dollars into in that hospitalization, and who would still have so many barriers to optimal child health, at least at the time of discharge, mold in their walls was not one of them. And for that family, that's a big deal. And it should be a big deal to those of us who care for that baby in the NICU. Advocacy can also fill a different type of cup. The cup, or really the tank of energy that for so many of us became so depleted in 2020 and 2021. That tank that allows us to have the same amount of compassion and energy and drive and motivation and empathy for our patients as when we first walked into the unit or the hospital or the wards or the clinics or the operating rooms when we were first starting our journeys. The truth is that those of us in neonatology we've heard today and will continue to hear, we are always at risk for burnout for all the reasons we've heard, right? We literally wind a path along a precipice between life and death for babies. We stare into this abyss of pain for families. We have so many unanswered questions, so much administrative burnout. We see all this pain and we witness it and thus we carry it. There's hope, there's joy, absolutely, but there's also all of that. And so it is important to recognize that sometimes when we are most burned out by the things that we are dealing with in our day-to-day practice right in front of us, sometimes we can convert those dying embers into fuel for something much larger than ourselves. Certainly that's been the case for me when I am most burned out by my day-to-day practice. It's almost when I feel the need to just engage in something bigger than me because what I am touching is too much. What I am touching, I can't handle. And that only happens sometimes, because sometimes all we have is to heal, like we just heard of. Sometimes that's all we can ask of ourselves is just to heal. But when we can't achieve that transformation, inevitably someone is watching. someone who is trying to figure out what kind of person they want to be in medicine and in society. And that's a different type of cup that we fill even without realizing it as well. So the question to me then becomes, why don't we be really intentional about it? Really intentional about the message that we're crafting, sometimes without thinking about it. And to me, it comes with recognizing the beauty and really raw power that is embedded within our own identities. So I'll use myself as an example. I advocate from a place of knowing what it's like to face critical illness with my patients as a neonatologist. I also advocate from my expertise as a scientist, as a collector of data, an interpreter of numbers. Those are all tools that I use in my advocacy journey. But more and more, I recognize that there is a lot of power to advocate from my perspective as a woman who immigrated from Colombia as a young child and has learned to live in this country as an immigrant. And absolutely to issues of maternal and child health and racial equity, I advocate as the wife of a Black man and the mother of two vibrant multiracial children. It's personal, and it can be, and there's power to that. So I ask you, what message is your voice really uniquely situated for? I told you about mine, but you each have voices. And it might be something you're really passionate about, and it's very easy to identify because it fires you up. Or it might be something that you just can't stop thinking about, like a pebble that you keep turning over and over in your pocket, something your mind can't move away from, something that you're just drawn to for some reason you aren't quite sure. But it is a message, and it's something that you are uniquely situated to convey. So why practice intentional advocacy now? Well, the truth is that there are so many issues that those of us with both scientific, clinical, and lived expertise in child health, our voices are uniquely situated for. There are too many stories for me to screenshot for, but I picked these 5 for 2 very specific reasons. First is that if you could look at the dates, you'd see that they're recent, all in the last few months. Some of these came out last week, these headlines. Recent, pressing issues. And then the second is that whether we are comfortable admitting it or not, even those of us who practice within shiny ICUs in the United States, our expertise matters to these issues because they all impact child health. And we take care of children, and we discharge children out into the world. And so as people who take care of children and who hope to discharge them into society, into the world, our expertise matters to these issues. They are our patients that we love and care for when they are ours. And so we should care about the world that we discharge them into to make sure that they are safe and well loved and well cared for by healthy parents and have every opportunity to thrive for all the reasons that we cared when they were inside our NICU. So one last piece of advice as you decide on your advocacy journey, and that's to empty your cup. And I know I just told you all the ways in which advocacy can fill your cup or fill the cup of others, so I'm going to tell you the story. So once upon a time, there was a wise Zen master. People traveled from far away to seek their help, and in return, the master would teach them and show them the way to enlightenment. On this particular day, a scholar came to visit the master for advice. "I've come to ask you to teach me about Zen," he said. But soon it became obvious the scholar was full of his own opinions and knowledge. He interrupted the master repeatedly with his own stories and failed to listen. The master calmly suggested that they should have tea. So the master poured their guest a cup, and the cup was filled, yet they kept pouring until the cup overflowed onto the table, onto the floor, and finally onto the scholar's robes. And the scholar cried, "Stop, the cup is full already, can't you see?" "Exactly," the Zen master replied with a smile. "You are like this cup, so full of ideas that nothing more will fit in. Come back to me with an empty cup." To advocate is to speak out about a cause that affects us or other people, often all of us. Sometimes being an advocate means setting aside what we know and feel to allow for the thoughts and feelings of other people. Because we can't pour into a full cup. It should be pretty obvious. But it's true because our cup, our minds, our souls are often so full of the things we have sought to pour into it, to learn, to actively cement in our head and in our mind. And our own beliefs about what the solution should be or what the strategy or the next step should be can sometimes make it hard to accept other solutions, other ways to move forward that may affect the change we actually want to see. Frankly, this is the hardest part of advocacy for me personally. It's hard for me in life. I try to remember it from my marriage. Sometimes he could be right, but this is an important step when we want to be the most effective advocate that we can with our own voices, is being really intentional about letting go of the things sometimes we hold most tight to allow for other ideas. So I urge you to keep your cup open to new ideas so that you can advocate in the most full way, in a way that I hope will fill your life with purpose as it has done for me. And I'd love to hear about it. I'm easy to find. Thank you.